Perfect. All right. Is everyone in, Steph? Yes, perfect. All right. Welcome, everyone. I just want to thank you for joining us in our Brave Spaces seminar. This is, of course, hosted by our division, the Society for Health Psychology, but also co-sponsored by the Society of Clinical Psychology, which is Division 12. I'm Patty Moreno. I'm the former chair of the Diversity Council. And before we begin, I'm just going to go through a couple of housekeeping items. Today's presentation, and of course, all virtual presentations offered by our society are a free benefit of your society membership. So please make sure that you invite your colleagues and students and trainees in order to ensure that we are able to keep offering great seminars like this and people can take advantage of our society benefits. And then, of course, many of you are here because this webinar is eligible for one continuing education credit under the co-sponsorship with the Society of Clinical Psychology. So the CE evaluation information will be sent to you via email for everyone who attends the full presentation. So shortly after we finish, the portal will be open for 1 week until 5 p.m. Eastern on Thursday, October 10th. So please make sure to complete everything before then. Your certificate of CE will be sent via email within 5 to 10 business days after the evaluation period closes. And everyone is encouraged and invited to please submit any feedback via the evaluation, even if you're not seeking CE credit. Great. And now I'm going to pass it over to John Tsai, who served on the Student Advisory Council and was a major part of creating the Brave Spaces initiative so that he can introduce our speakers and our session today. Thank you so much for being here.
Thank you so much, Patty. Hello, everyone. My name is John, and I served as the past Diversity Council representative for the Student Advisory Council. The goal of today's session is to provide an overview of the recently released APA Journal Article Reporting Standards for Race, Ethnicity, and Culture, or JARS-REC, and the Equity, Diversity, and Inclusion Framework for APA publishing so that participants publishing psychological science learn how to adhere to these comprehensive set of standards to promote transparency and methodological rigor in how we analyze race, ethnicity, and culture. I'm honored to introduce our speakers today. Stephanie or Steph Pollock, MPS, is the Equity, Diversity, and Inclusion Lead for the American Psychological Association's Journals Program. In this role, she directs and implements EDI initiatives for APA's 89 journals. Working with APA staff, editors, and governance, as well as groups outside of APA to promote equity and improve representation in science and scholarly publishing. With more than 13 years in the publishing industry, Steph is committed to using her platforms and the power she inherits from her identities to advance social justice and amplify the voices of people with lived experiences of oppression. Sheree Horn, MPS MBA, is the Science Programs Officer in APA's Office of Science, Equity, Diversity, and Inclusion. With professional experience shaped by roles at the University of Maryland and Johns Hopkins University, Sheree brings an interdisciplinary approach to fostering science, equity, diversity, and inclusion. She cultivates an environment where diverse voices thrive and scientific excellence flourishes. Eli Putterman is an associate editor of the Society for Health Psychology's flagship journal, Health Psychology, and an associate professor at the University of British Columbia. Dr. Putterman will talk about ongoing initiatives at Health Psychology relevant to the JARS-REC and EDI publishing framework. And with that, I'll pass it on to our speakers.
Hi, good morning. Oh, it's afternoon now. Good afternoon, everyone. Thank you, John, for that warm welcome. If it's okay, I'll go ahead and share my slides. Can everyone see okay?
Looks good.
Great.
All right. So today, Steph, myself, and Dr. Putterman will be presenting on the Journal Article Reporting Standards for Race, Ethnicity, and Culture.
Thanks, Sheree. Yeah, great to be here with you all. Thank you so much again to Division 38 and 12 for inviting us to join this Brave Spaces session with you all, and a special thanks to Patty and to John for your invitation and for welcoming us here today. So just as a little bit of context, we're going to sort of start by sharing some context around JARS Rec. I'll pass it off to Sheree, who's going to talk more about how these standards inform the work in health equity, and then we're going to sort of culminate with the really meaty part of our conversation, which is talking about some of the highlights of the recommendations that you'll find in JARS Rec to inform the work that you're doing. And then we'll close it off with Dr. Putterman's sort of presentation and conversation around how they're infusing that work into health psychology. So it's going to be a great conversation. We really look forward to talking with you all about this. So just as a bit of background and context for our conversation today, for those of you who aren't familiar, JARS Rec was developed in response to APA's 2021 apology to people of color for the organization's role in perpetuating and upholding racism. Historically, of course, as many of us know, psych research has undervalued racial and ethnic minorities and has overrepresented perspectives from primarily Western and white populations. So this history, in combination with an really insufficient reporting on race, ethnicity, and culture in a lot of the research that is published, means that the conclusions that we have in that literature are often biased, or they misrepresent cultural differences as deficits. So these are just a few examples of the reasons as to why JARS Rec was sort of seen as a necessary advancement for our field. So the goal really is for JARS Rec to rectify some of those systemic problems by creating a standard process for researchers on how they're researching on reporting culturally sensitive research. So as you'll see throughout our conversations, the sort of primary target audience for JARS Rec is folks who are sitting down to write about the research that they've conducted, but the hope as well is that over the long term, JARS Rec can also inform how you are designing your research and conducting it as well. So in light of sort of that historical context, the APA Board of Scientific Affairs convened a working group to create these guidelines, and they were published in the fall of 2023. So I had the pleasure of serving as a publishing staff liaison to that project. It was primarily led on the staffing side by Sheree, who's going to talk in a minute. It was a wonderful experience creating the standards, and we're really excited to share them with you all now today. So with that, I will pass it off to Sheree to talk a little bit about the perspectives from health equity.
Thank you, Steph. So I'll be speaking a bit more about inequities in health psychology and how it relates to the JARS Rec. So we know that health disparities are deeply embedded in social, economic, and cultural inequities. At the intersection of behavioral science and health, health psychologists are uniquely positioned to both study and mitigate those disparities. These disparities disproportionately affect marginalized populations in terms of access to care, prevalence of chronic diseases, and mental health outcomes. There's also a history of unethical research practices, which have led to a lot of mistrust, especially in marginalized communities. However, to combat this, our research and practice frameworks need to evolve to reflect diverse realities. So we know that we have a weird problem in psychology. Most psychology research relies on weird populations, as Steph mentioned, Western educated, industrialized, rich, and democratic, which are overrepresented in studies. The problem with this is that findings from these samples do not always apply to diverse populations. This limits how much we can generalize those results. This means that interventions and measurement tools developed using weird samples may not be effective. Yes, so they may not be effective or appropriate for non-weird populations. All right, so introducing the JARS Rec, the Journal Article Reporting Standards for Race, Ethnicity, and Culture are an extension of the APA style JARS. The original style JARS provide framework for quantitative data, qualitative, and mixed methods. And additionally, the JARS Rec were vetted by international experts to be globally relevant. So you may ask, what's the relevance for health psychologists? As health psychologists work to understand and address disparities, JARS Rec offers a vital framework that ensures research and inclusive and culturally relevant, helping to translate findings more effectively into practice. Furthermore, it addresses biases by addressing sample diversity, contextualizing health outcomes, measurement, and analyses. It is important to clearly report the racial, ethnic, and cultural makeup of your sample and explain why you included or excluded certain groups. Do not forget to discuss findings within the within the context of cultural and social factors. This avoids misinterpreting results and help us to understand the bigger picture. Using culturally validated tools and make sure that you explain how you use those measures and how they are sensitive to the population you are studying. This ensures accurate and meaningful results.
Thank you so much, Sheree. So yeah, now we're, as I said before, going to get kind of into the meaty parts of it and talk about highlights from each of the sections of JARS Rec. So I dropped a link to the full set of standards in the chat. You're welcome to review those at your convenience. But just to sort of, again, frame how we are discussing this. So the JARS Rec are structured so that they're addressing, much like the original APA-style JARS, for those of you who are familiar, addressing what authors should be including in each section of their manuscript. So again, as you are sitting down to write your research. Next slide, please. So these are just a few sort of big picture example standards that you'll find throughout JARS Rec. So for example, the standards encourage authors to explain the language that they're using and the terms that they use for race, ethnicity, and culture, and to be transparent in reporting who their community partners are. They encourage them to disclose their positionalities as it relates to the research question, to clearly identify how the authors have contributed to the study, using sort of standard taxonomies like CREDIT, for those of you who are familiar with the contributor roles taxonomy from NISO. It also has the themes of encouraging authors to avoid ethnic loss by aggregating identities, and to always include the national and cultural context for the study, even when the research questions themselves aren't specifically about race, ethnicity, and culture. So the idea here is that regardless of the research question, you can hopefully use JARS Rec as you're sitting down to write your paper. I'll also say that the standards are designed to be globally relevant. So although, of course, definitions of race, ethnicity, and culture are going to vary by region, the idea here is that all research invariably incorporates some or all of these concepts in some way. And so the standards were designed purposefully to be relevant sort of regardless of the communities or areas that you are conducting research in. Next slide, please. Thank you so much. So starting with the title and the introduction, some of the recommendations that JARS Rec includes are things like asking authors to clarify the race, ethnicities, and cultures of the study participants, not just within the methods section, but also upfront in the title and the abstract and the keywords. That makes that information more discoverable, right, for people who are conducting research later on. It also, in the introduction, encourages authors to take a culturally competent approach to how they're framing their studies. So, for example, you want to avoid signaling whiteness as a default or a norm, and you want to make sure that you're grounding your research questions in the appropriate historical and cultural context, including the regional context, as I said before, since the definitions of race, ethnicity, and culture are going to vary by region and global community. Something that I think is especially important is that JARS Rec advises authors to favor strengths-based models when they're framing their research where appropriate. And again, you're going to see this as a theme, pretty consistently throughout, to avoid aggregating. If you are aggregating your participants, you need to be transparent and rationalize why you did so. So that is sort of some of the meaty parts of that section. Sheree, I saw you unmuted, so please feel free to chime in.
No time in, I was just going to do next slide.
Yeah, that's perfect. Thank you.
I
appreciate it.
So our next section is our methods session. So we really want you to be thinking about the JARS Rec at the inception of the research question and design. So that's clearly stating how race, ethnicity, and culture were considered within the research design. Make sure you're defining your own positionality and describe who had input on the research design. So this could include your community partners, this could include your research team. Also, it's important to recognize that cultural mistrust can affect participation and impact experimental interventions. Also, for your inclusion and exclusion criteria, that's your sampling procedures. Explain the sample selection criteria. If it lacks expected racial and ethnic diversity, provide clear justification as to why. And it's important to remember that in some regions, tribal affiliation and religion are identities that can supersede ethnicity or race. All right, so highlights continued. We'll talk a little bit about participant characteristics, measures, and data collection. So really breaking your paper down. So for your participant characteristics, again, please clearly describe racial and ethnic makeup of the sample as detailed as possible. If focusing on specific groups, explain the recruitment materials and language used. So let's say that you're focusing on a Spanish-speaking group, it'd be important to highlight that in your methods that the recruitment materials were in Spanish. Summarize how race, ethnicity, and other identifiers were asked in a survey. Mention if open-ended options were allowed. And again, the relevance for doing that can depend on your research funder. We know that entities like NIH may not allow for open-ended options. So being able to do that when you're able and relevant, and it's relevant to your study is important. For your measures, explain the reliability and validity of the measures used in the study sample, especially for each subgroup when relevant. Summarize and evaluate the cultural validity of the population study and describe any adaptations to measures being made for different racial and ethnic groups. Again, so let's say you are using a specific tool for a Spanish-speaking population or sample. It's important to say that those tools of measurement were translated, and hopefully you will want the meanings to be the same as they were in English and in Spanish. So for data collection, explain how the sample was recruited in efforts to ensure participation from underrepresented groups. Also, if your interviewers or coders were used, it's important to describe their identity as well. Okay, so in your results section, we'll talk a little bit about your missing data, analytical report approaches, and your reference group. So for missing data, it's important to report any missing race or ethnicity data and describe what adjustments were made to account for it. Make sure to explain how these missing data might affect your overall study results and interpretation. In terms of the analytic approach, ensure that the way you're analyzing race and ethnicity fits with your research question. It is also a good idea to use sensitivity analyses or weighting to address any potential biases caused by sample imbalances. When it comes to the reference group, avoid automatically using white participants as the baseline for comparison. Like Steph had mentioned, we want to stay away from deficit frameworks. Instead, ground your comparison in a historical and cultural context relevant to the groups you're studying, which leads to more meaningful findings.
Thank you. Yeah, so I'm going to talk a little bit about some of the expectations for the discussion section. Certainly extending upon the points that Sheree just made about the reference group. When you're interpreting your results, the JARS-REC advises that authors should bring the cultural context to your interpretation as well. Specifically, and again, I really love this point because I think it drives home the importance of using research to advance social justice in the work that we're doing. JARS-REC tells authors that they need to be specific in naming the systems of oppression that might affect the participation and the outcomes, and to challenge system justifying beliefs or practices with your findings. So for example, actually the example that's used in JARS-REC is that you can address how racism or colonialism fuel disparate health outcomes between communities. Perfect example for this audience, of course. The JARS-REC also advises, again, that you should discuss the author's positionalities and how their identities might have affected the conceptualization, methods, analysis, and interpretations of the findings. I know Eli might touch on this in a little bit, but this is something that health psychology also recommends that authors do as well. I think our general guidance would be, you don't need to go so far as being required to report that information. Obviously, there are some risks involved with self-disclosing identities in certain communities, so we would never be in a position of, requiring authors to disclose their positionalities, but if you feel comfortable doing so, that's a really important way to sort of frame the research. And then lastly, again, this is going to be another theme you're going to see popping up a couple times throughout these last few sections. It's important to acknowledge when the work from outside your discipline might have already made inroads on the research topic. So, different research areas like African American and African diaspora studies, Chicano studies, ethnic studies, queer theory, sociology, law, public health, it goes on and on and on, women's and gender studies. These are all areas that may have already made inroads, and it's important to bring those reference points in as you are interpreting the results. Excuse me. With regards to generalizability, you want to identify and justify the target populations for the study's findings and to acknowledge what the readers need to bear in mind when applying your findings to different racial and ethnic groups. So those of you who are familiar with open science practices, JARS Rec also encourages authors to include a subsection called Constraints on Generality to discuss the study's limits of generality, and again, health psychology encourages authors to do this as well. JARS Rec specifically says, and now I'm quoting here, people of color come from a wide array of backgrounds, including but not limited to social class, education, geographic region, place of birth, and ancestry. Be as specific as possible in describing these features to help the reader understand to whom these results generalize. And then more broadly, again, this is a really important sort of frame of reference for all of us working in research and in science. It's important to recognize and remember that generalizability is not the primary purpose of every study. Obviously, that's useful for you as authors to keep in mind, but that's also, a framing point that we want to bring to editors and reviewers as well. And every study is going to have historical, socio, and cultural context. So with regards to implications, you want to describe how the findings can address systemic oppression. So thinking about how does your research improve the human condition and address that upfront in the implications section of your paper. You want to highlight where your research can be adapted or furthered to advance the understandings of marginalized groups. And then again, this is one of my sort of favorite points within JARS Rec. You want to directly address whether the findings could be used or misused to cause harm. Not only address that, but also discuss how to mitigate that potential for harm when you're talking about the implications for your research. Next slide, please. So this is sort of the last area, talking about references and your practices for including references in your papers. So JARS Rec calls for equitable citation praxis, meaning that authors should be mindful of who they're citing and try to incorporate diverse and representative perspectives. There's a growing body of research that has really shown that women and people of color are far less likely to be cited, meaning that, of course, their research is undervalued and ignored compared to that from authors who are typically white and male. So there are a lot of tools out there for assessing the gender and racial distribution of your references. I'm happy to talk about some of those resources during the Q&A portion if anyone is interested. But I also know that some journals now ask authors to include citation diversity statements in their papers, sort of affirming that they've incorporated diverse sources in their work and encouraging authors to think more critically about who they are citing. JARS Rec specifically also calls on authors to review research in small specialty journals by authors of color and to avoid citing papers without having read them, especially those more historically classic papers that may have sort of outdated concepts of race, ethnicity, and culture. Similar to the guidance in the interpretation section that I talked about before, JARS Rec reminds authors that they should cite outside of their disciplines, as I said, since those adjacent fields who are more at the forefront of diversity science and social justice science are valuable and should be acknowledged as well. Next slide, please. So we've talked mostly about how to use JARS Rec as an author, but we also see this set of resources as a tool for informing how you review research as well. So throughout the document, again, for those of you who have read it, there are specific key points that call out sort of themes that reviewers and editors should pay attention to as they are evaluating research that comes across their desks. So the items on this slide are just a couple examples of some of the ways that reviewers could use JARS Rec. So for example, reviewers should understand that the theoretical framing and the sample descriptions for populations of color might require more space. So you should bring some degree of flexibility to the word limits that you're imposing upon authors as you're reviewing papers. Of course, a theme throughout this set of standards is that you want to avoid implying that white participants are normative in your review. You should call out when you notice that authors have incorrectly interchanged race, ethnicity, and culture. You can acknowledge when sample inclusion goals might face limitations, like Shirai said at the beginning, based on feasibility, issues of cultural mistrust, or other relevant cultural contexts that can inform those goals. As a reviewer, you also have a responsibility to encourage authors to name systems of oppression in their framing and in their interpretations of their research. And again, to point out when the findings could be used or misused to cause harm to vulnerable groups, and then ask the authors to address that explicitly in their papers. Reviewers are also empowered to encourage authors to cite outside their disciplines, as I've said before, and to provide recommended references to the more formative works from social justice-oriented fields. So again, as a reviewer, you have that power to encourage authors to sort of expand their horizons as to who they are citing in their research. So that, I think, summarizes our section of the conversations. I know we're only about 30 minutes in, but I will pass it off, I think, now to Eli to talk a little bit about how you are integrating JARS-REC and EDI into health psychology.
Fantastic. I will try to keep this under 10 minutes because I know that we have probably a lot of questions on the group. Can everyone hear me? Yeah. Fantastic. So I am Eli Putterman. I am an associate professor at the School of Kinesiology in the University of British Columbia. I am a health psychologist, clinical psychology trained. I am also, I identify as he, him, and I am a cisgender man. I identify within the G of the LGBTQ S plus, the 2S plus, for 2S is for two-spirited. Here in at UBC, I am also the chair of the Equity, Diversity, and Inclusion and Decolonization Committee that's in the School of Kinesiology. In Canada, we have a very heavy focus on decolonization and truth and reconciliation with Indigenous peoples. Just the other day on Monday, we had Truth and Reconciliation Day, which is an honoring of the damage caused and the strengths within the Indigenous people. So I'm going to talk briefly about health psychology, our journal, our mission statement, and also our mission statement around EDID. And I think that the JARS-REC is a really fantastic guide for how our editors, our associate editors, really frame when we review papers to see whether they're worthy, in quotation marks, of inclusion within our journal. And we also provide a lot of feedback to authors. I think we can always do better jobs. And I think John Dr. John Ruiz from University of Arizona, who's the editor-in-chief, would probably agree that we can keep pushing more. And I think one of the reasons I wanted to work with John as associate editor was his commitment to equity, diversity, and inclusion within the journal, both from a leadership perspective, but also from within the journal and what gets published, has just been mind-blowing and really forward-thinking, in my opinion. So I do have a slideshow that I will bring forward. And let me just make this larger. So health psychology is Division 38, which everyone here knows. If you go to our website, we have here an equity, diversity, and inclusion statement. So we do support equity, diversity, and inclusion in our practices. And I'll then show you some of the EDID efforts. So first, let me read to you what our statement is. So our statement is, health psychology is strongly committed to advancing diversity in all areas, including, but not limited to age, socioeconomic background, race, ethnicity, culture, gender, sexual orientation, religion, language, abilities, and the intersection of multiple underserved identities. In this context, the editorial team strives for inclusive excellence, the belief that our mission to advance population health is facilitated by promoting diversity in who we are, our representation, the scope of work, and how that work is achieved. Through these efforts, we aim to create a more welcoming space to advance understanding of public health challenges, optimize the associated research efforts, harmonize research with the very communities we aim to benefit, and establish a sustainable pipeline of inclusion and representation for the journal's future stewardship. I strongly believe that in addition to ensuring that our and John believes this, our whole board believes this, and in addition to ensuring that the papers that are included in the journal are of diverse representation and inclusive, that one of the ways to benefit that is the team membership and who is part of the team. So right now, actually, Linda Gallo, this is a few months old, this slide, but it was the only slide I was able to get. Linda Gallo has stepped down recently as one of the senior editors, associate editors. Janet Tomiyama has stepped in from UCLA as an associate editor. But as you can see in the bottom left, we have the editor-in-chief, John Ruiz. We have a senior associate editor, Frank Pinedo, and a team of diverse associate editors. And in fact, if you look at our representation of an editorial board, we have 11 members, including the editor-in-chief, 6, actually now it's 7 women, 6 scholars of color, 2 international scholars, one of them being me. We have members who are identifying as sexual and gender minorities, and we've all demonstrated record in health equity. So we're not just these tokens, you know, the representation is not just tokenism, but it is really people who are committed to health equity within their research as well. We encourage all of our, and we can't force, of course, but we encourage all of our members who are on the board to provide their photos, our pronouns, and bios that identify with our identities on the journal homepage. And you'll see that everyone does capture some diversity within their statements. We also have a consulting editor team of over 100 scholars that include a range of disciplines from varied disciplines, that's psychology, medicine, public policy, anthropology, epidemiology, and so on. And approximately 2/3 of our consulting editor board comes from a range of underrepresented identities. And then we encourage all reviewers and authors to complete the new APA demographic survey so we can really assess whether we are having an impact with our efforts and the degree that we're having this impact. We're really trying to seek a diverse sample of authors as well. So we've taken a number of different steps for inclusivity within the research. So we look for commentaries and special issues to highlight population science issues. Currently, I'm preparing, and it's a slow preparing, but we will have a call, hopefully at some point, on community engaged participatory research. That is one of our goals. And I think, you know, as everyone here is familiar with, is that these CBPRs type of research practices are typically with and for and by individuals who come from diverse backgrounds and seek to support individuals with, by, and for, and, you know, in collaborative ways from communities from diverse and underrepresented samples, so participant pools. So we are trying to create the special issue on this topic by bringing more voice, which also leads to, as the third point here, is this openness to actually different ways of presenting our research. In health psychology, we're very familiar with the quantitative approaches, but we also know that this type of special issue will have a lot more qualitative approaches that have a lot more depth and meat to the topics. We also have Spanish translations of all of our abstracts, as was talked about. And then on a monthly basis, whenever our journal comes out, we have a change of our cover art. So this is just one example of our cover art. And, you know, it used to just say health psychology. It was a green cover. Sometimes it was a different color. But in general, it was, you know, a very static color that never really changed. So now we're trying to show and highlight different cover arts. And I wanted to bring all of the different, I think we implemented this about a year and a half ago. I wanted to have a slide with all of them. I couldn't find them all, so I'm just representing one of them. But this is one from the Roman Empire and mythical Roman god Vulcan, who built the first automatons of eternally embracing couples discovered throughout this empire. So this is like really some of the art that came out of Rome, and it really talks about love and about embracing couples. And we had one that said, anyways, I forgot. There's just many different types of art covers that we've had that have shown diversity in, here we have some anthropology and so on, but we've also had some other showing diversity in people as well. We do require an impact statement as discussed in the JARS recommendations. We have, again, required sample descriptions and justifications to ensure diversity in a wide range of socioeconomic status. And we also require that authors clearly communicate reasons for some exceptions or not reporting some of the diversity or differences in SES. And we are also trying to improve our access to our papers. So we participate in the Editor's Choice program, which does provide one free article on a monthly basis. So if you go to the Society for Health Psychology, you'll see some of the highlighted ones that are our Editor's Choice. So one of the most recent ones was by Dr. LaBrianne Goodman, an analytical framework for the embodiment of structural inequities. Another one, racial differences in physical activity, engagement barriers, and enjoyment during weight loss. So this is the editor selecting specifically diverse types of manuscripts that get able to be downloaded for free to individuals. We also have, and I think this is one thing that really is exciting, these editorial fellows. We're currently in our second round of editorial fellows. This current round is 6 fellows. I'll show you in a moment the slide of last year's fellows that was recently presented. So there are current 6 fellows are purposefully selected from underrepresented groups within the field of health psychology and within editorial boards. We purposefully pair these fellows with an associate editor who specializes in their research area of interest if possible. I was paired with Anna Epperson, Dr. Anna Epperson at UC Merced. She's an Indigenous scholar who does a lot of community-based research, and she was my mentee, and I guess I was her mentor, and it has led to potentially doing some collaborations in the future, and it really was a thrilling experience for both of us that led to her coming to the Academy of Behavioral Medicine Research as an EDID fellow. It's been really a fantastic opportunity. So if anyone's on this call who comes from an underrepresented background, this editorial board fellow position, and also ABMR, Academy of Behavioral Medicine Research, is a great place to start showing different representations of who we are as a field. The AE fellows, the editorial fellows are trained on how the review process works, the triaging, the choosing, the integrating reviews. We have monthly meetings with the EIC. They get credit on the journal masthead. We provide letters of support for promotion and other career-related advances. And there's a $1,000 honorarium for the editorial fellows. This is the 2023 APA HP AE fellows that we had, and Epperson, Caroline Cummings, and so on. These were the people who were part of our team last year. And on that note, I have finished my slideshow. I will take us off Zoom. If anyone has any questions, I'm more than happy to talk about anything that we're doing at the journal on the stuff that I presented or anything else. Thanks.
Thank you so much, Dr. Putterman. Yeah, I think it's so helpful to have a framework about what's going on in our flagship journal. And I think a couple of things that I took away from Steph and Share's presentation is science as a way to advance social justice. I think that really was a cross-cutting theme, but something that was said kind of specifically in those words, and the importance of remembering that every study has a social, political, cultural, and historical context. And the point of a study is not always to generalize or to compare to sort of the majority group. And there's so many nuances within the JARS Rec, but we know that change is adopted at different rates in different places according to social, political, cultural, and other forces. And so what I put in the chat was the actual citation for the JARS Rec, because I think that if you are adhering to JARS Rec guidelines and at some point get a reviewer or have some pushback about the sort of scaffolding or reason for why you're making choices or reporting your work in a certain way, I think it's really powerful to have that to refer to, given that APA adopted this framework and these set of guidelines. So with that, I want to open it up because I'm sure that people have questions. We couldn't go through every single guideline, but I think a lot of us who have worked in inequities and disparities have had frustrating or challenging experiences trying to get our work out there, or having to justify, why you don't have a comparator group, why you did just focus, for example, for me, on Hispanics and Latinos and didn't include another sort of racial or ethnic group to compare, right? And so, yeah, I think this would be a really good opportunity for questions of clarification about the JARS rec, or just open discussion about your experiences trying to do this kind of work or advance social justice in your science. So I'll open it up for comments, questions.
I will just chime in, Patty, to say while people are sort of thinking on their questions, I love the point that you make about using JARS rec as sort of a tool to push back against maybe the pushback that you might get from reviewers and editors who are evaluating your research. I would even go a step further and say include that citation in your cover letter when you're submitting your papers to a journal, right? Pointing out to the editors, this is why I have framed my research this way, and according to APA style JARS rec, this is an important way to frame that research. So yeah, absolutely use that as a tool for improving the way that you are conducting your research, but hopefully, to your point, Patty, it also just reinforces the importance of the research that many of you are likely already doing.
Absolutely. Thank you, Steph. Stephanie, our president.
Hi, everybody. This is a great presentation. I'm curious in terms of when you all were doing this work and putting these guidelines together, was there communication with medical journals? So I know that certainly JAMA has started to go through, a process in terms of how we refer to race and ethnicity, not just the slash anymore, unless there's a reason for why you're using the slash, and trying to use more inclusive terms. But for a number of us, we publish in primarily medical journal. I'll just speak from I publish primarily in medical journals. I've actually never published in health psych, not as a primary author. And so I'm just curious about, was there any conversation with medical journals, or how would you advise some of us that are publishing in these other journals to speak to these issues and to justify? I know you just said certainly including your cover letter, but other ways in which we can kind of advocate for other journals starting to pick up these similar guidelines and practices.
I'll speak a little bit about the groundwork to get the JARS rec. So we did have a stakeholder group of about 12 liaison groups. I don't think they specifically included medical journals, but they were a full breadth of different sciences. So we had, okay, thanks. Steph put it in the chat. So we had behavioral scientists, we had neuroscientists, so just a full breadth of input. And our stakeholders were very involved all the way up into the end to shape this. So we do feel like the JARS rec, though it's housed in psychology, clinical psych, health psychology, we do feel as though it translates to the sciences in general.
And I will just chime in to say, to your point, Stephanie, I know AMA, like you said, JAMA has similar sets of reporting standards. It's been a while since I've reviewed them, so I am not, I wouldn't say I'm as intimately familiar, but I think the hope is that a lot of the guidelines that you might find in those sets of resources will intersect with that of JARS rec. So the hope is that there's sort of community consensus across the different disciplines as to how we can advance social justice through the science that we're conducting. It's a great question.
Other questions, reflections? Dr. Putterman.
I have a question as well. So, when transparency and openness, the TOP, get what the P stands for, part of as an AE and part of the journal was these recommendations on transparency and openness, and journals signing on to these recommendations. And there's 3 different levels, and ensuring that the authors are following that. And then as I submit a manuscript to health psychology, that's part of the checklist, right? Are there plans to do similar with the JARS rec, whether it's part of the checklist is have, do you have levels of recommendations for JARS that will get incorporated into the journal, especially when people are submitting? So it becomes something that, they might not want to talk about their EDID plans, but at least they're saying that they're not talking about their EDID, right? Or what level they want to talk about. Is that part of the planning? Sorry, Steph, I see you nodding your head, so I think you might have an answer.
That's okay. I'm happy to chime in, but Sheree, of course, is our amazing representative from our science directorate, so I'm sure she has thoughts as well. But I will say from the publishing side of things, right now, the sort of foundation and way that we are framing JARS Rec is that it's a tool for authors to improve their research. So now it's, we're sort of presenting this as like, this is not prescriptive, but it's encouraged because your research will be stronger if you use JARS Rec. To your point, Eli, I think that there is some value in sort of pushing that conversation a little bit forward and saying, all right, it was a tool, and now that you're familiar with it, it's sort of the baseline expectation for your field. I don't think we're there yet, but to your question about sort of using that to inform submission checklists, so you all are getting kind of a preview to some of the things that will come out in 2025. But the journals program has been working on an equity, diversity, inclusion updates to our equity, diversity, inclusion toolkit for journal editors, which is going to include a whole new section on JARS Rec. And part of that is, again, this is guidance for editors, but authors are welcome to use it as well. A sample, an example sort of author questionnaire that editors might include in the submission guidelines for their journals. So our hope is that Health Psych and other journals would be interested in adopting some of that in the ways that make sense to your field, right? Because not every question in JARS Rec is going to be relevant to every subfield, or every standard, I should say. But the hope is that if we can sort of, to your point, present that framework of, these are ways that you can ask authors to adhere to X, Y, and Z, it makes it a little bit easier for journals who want to take that next step of saying, now it's not just a recommendation, it's the expectation for how you are framing your research. Hopefully that's a set of tools to come. So the plan is for that to publish in January of 2025. John Ruiz, the editor of Health Psych, of course, will be informed when that happens, but we encourage you all to keep an eye out for that update as well. And Sheree, I'll pass it off to you if you have other thoughts about that too.
Oh, no, I was just thinking of it from the journal's perspectives. But as in terms for the JARS Rec, we did recommend the tops within the recs, just so we have that interdisciplinary field.
And then Dr. Marcia Tan brought up a question in the chat. She's the new chair for the Diversity Council. And I think this is kind of building off of Dr. Fitzpatrick's comment. She said that it's been a discussion point in her research circles, this idea of combining race, ethnicity into one variable versus splitting it. And I know that offline we've talked about how there are certain sort of subgroups that may primarily only, like Hispanic, Latinos, Latinx, Latinx, oftentimes sort of only identify strongly with their ethnic identification and not, with any particular one racial group. And so, yeah, I think she just wanted to ask, like, how are people thinking about when it makes sense to be really distinct about those? And kind of, I think, Dr. Fitzpatrick, you mentioned that JAMA took a position on always kind of separating them. Is that right?
Well, separating them in the sense of what they mean. So when you put race/ethnicity, you're almost saying ethnicity is a proxy to race. And as we know, race is a social construct and ethnicity is actually related to people's culture and things. So where they were coming from is that they're not proxy to one another. But how you handle that in the data, I think just being explicit about how you present. I am one of those people that when I have my table 1, there's a demographics, I do combine race ethnicity in that I have, you're Black, you're white, you're Hispanic, you're Asian. And I'm at an institution now where they have a practice of, they have the races and then they have Hispanic ethnicity, yes or no. And I said, okay, so when we do a comparison, does that mean that Hispanics get compared to everybody? And then the other groups get compared, like, what exactly does that mean? And so that's usually how I handle it. I kind of combine it just to make sure that we have a group that's not necessarily just kind of taking on the whole load and getting compared to everyone as one fell swoop, which ignores then our Asians, Pacific Islanders, Black, etc. But that's just my approach.
I'll just say in the JARS Rec, we do encourage authors, researchers to break it down as far as they can. So that means having open-ended questions so we can get a full picture of the population being studied. That's a lot better than trying to generalize them to a larger group. Additionally, we did highlight this in the JARS rec as well. Basically, sometimes it does depend on who your funder is. We know that NIH, they just want the classics. So white, Black, Asian, they just want the classics. So if you have the flexibility, we do encourage authors and researchers to explain as detailed as possible, but we understand that that may not be applicable depending on who your research funder is.
Thank you. Yeah, and it's another one of the guidelines that was brought up was the idea of really explaining what terms you're using and why. And this is a conversation I had with Dr. Anna Epperson, who Dr. Putterman mentioned was one of the fellows where in the communities that she works with, in Indigenous communities, there's generational differences about identifying as Native American versus American Indian. And then you see the same thing in the Hispanic, Latino, Latina, Latinx community where, you know, depending on the sort of age generation, you see more adoption of terms like Latinx, especially if someone's, you know, English speaking and more aware of, you know, social, sexual, you know, gender minority issues versus older generations, sometimes kind of actively rejecting a term like Latinx and maybe preferring Latine because it's within the phonetics of Spanish and more sort of accessible for pronunciation. So anyways, yeah, I think that, and you do get reviewers who come in hot with like a lot of virtue signaling around, you know, you should have used this term based on like what standing, whereas when you're having active conversations with your community members, they tell you how they identify. And the most important way of honoring someone's identity is using their own, you know, identification language, their own labels for themselves and not imposing something because it's trendy in our sort of ivory towers. And so anyways, yeah, I thought it was very interesting when Dr. Epperson was kind of educating me on how there's also sort of age generational differences in the terms that, you know, Indigenous Americans use to identify themselves. But yeah, I think all of that goes back to this idea of using JARS rec as a way to kind of have a citation that really supports the approach that you're using for the why and the what you do. Yeah, thank you, Steph. You put that in the comment. Okay, so we have Edgardo Ramirez, who's a new member of the Student Advisory Council and a liaison to the Diversity Council in our society. He says, any recommendations or suggestions for graduate students who are publishing on previously collected data, that is secondary data analysis, and submitting to journals like HealthPsych, since we may not have had a role in the actual design of the original project, how can we still maximize inclusivity and visibility in our writing? I think that's a really interesting question.
You know, as someone who writes a lot and uses a lot of secondary data analyses, and I hope it's okay that I step in here. I use a lot of secondary data: MIDAS, health and retirement study, Cardia study, in addition to collecting my own data. And I think one of the best ways to approach it is within the limitations section when it's already collected data, is really highlighting, and not just as a throw out, like we collected, you know, 30% were females, and not having a conversation around gender, you know, having a deeper conversation around gender, having a deeper conversation around gender identity, specifically highlighting that it might not be the most diverse group, highlighting that it's not just having that throw out like might not be generalizable, but really having a deeper conversation around these things within the limitations section that's more than a sentence. And I think that's the best place to start. And then for ourselves, as you move forward, as you move into your own faculty role, is to have these ideas within the back of your head that you will do, and I hate saying doing better, but doing something that is considered more current as a better, healthier approach to better representation. And I'm not, you know, a different approach that does represent people more. So if anyone else has something to throw in there.
Other than, so we did have a section devoted to that question in the JARS rec, and I see that Steph dropped it in the chat. So please let us know if you have any additional questions about that section, but it's covered.
Yeah, I think that, oh yeah, no, I was just nothing really more to add except to say that to Eli's point, I think the sort of focus is on describing, right? Describing what you're finding is missing, and with the intention to, use what you can, where you can, but understanding obviously you can't control everything when you're using secondary data sets. Sorry, Patty, go ahead.
Oh, no, I was going to say, it's so great that this is such a prime example where there's an actual section in the JARS rec are much, have a lot of detail, a lot of substance. And I think that even the fact that there's a whole section related to this that you can kind of go through and make sure that you're adhering to best practices and making acknowledgements where it makes sense, is huge. So thank you so much for sharing that, Steph. And we just have 1 minute left. So unless anybody else has any questions, I just want to remind you, I guess I'll do this and then we can check in if one person has another comment. But, again, thank you so much to our speakers. This has been an incredible session. We're so thankful that you were willing to join us and talk about these issues. And if you are trying to obtain the CE credit, please remember to promptly complete the evaluation link, which will be sent to you via email after our session ends. The evaluation stays open until October 10th, and then you will get your certificate within 5 to 10 business days after that October 10th deadline. So please also remember that you can submit an evaluation even if you're not seeking CE credit. We always want feedback. We want to keep doing sessions like this, hopefully to serve our membership. And if you have any questions, you can always email us at admin, like administrator, at societyforhealthpsychology.org. And again, thank you so much. And we just really appreciate your participation and being here today. And thank you, Dr. Putterman, Share, and Steph. This has been an incredible presentation. So thank you, thank you, thank you.